For more on this issue, I want to welcome on Congressman Andy Biggs, the Republican representing Arizona's 5th District. So, Congressman, when we talk about this latest idea of reopening schools, it's the latest part of the saga of these lockdown orders taking place across the country, whether it's businesses, churches, things like that. When it comes to schools, where do you stand?
Schools need to be reopened. They need to be going back to school. These kids, you need to evaluate the risk factors for being in school versus being out of school. And you're going to find that there's more risk for them being out of school than being in school. I mean, you've just been talking about it in your segment. And I'll just tell you, there's a German study that just came out in the last day or two, and it confirms exactly what I've said. Europe's opening up. Some jurisdictions opening up without any masks or gloves or plexiglass or anything like that. It's a better place for the kids to be in schools and learning than to be at home under a lockdown situation.
And of course, the White House approach to this, too, is kind of a wait-and-see approach, something that doesn't necessarily always make its way into the media. A lot of, for example, if you were to turn on some networks, they'll say that they're telling all the schools to open up right away, no conditions whatsoever, and we know that that's not necessarily the case. But this also falls on the backdrop of a little bit of tensions seemingly at the White House between Dr. Anthony Fauci and Peter Navarro is the most recent example, but also Mark Meadows voicing some concerns as well. But regarding the Navarro op-ed criticizing Dr. Fauci, you called it, quote, well-written and spot on. Do you want to elaborate on that?
Yeah, so Mr. Navarro was really taking Dr. Fauci to task, saying he's been wrong on everything. He's contradicted every position, and I've said that as well. Dr. Fauci admitted in the last few days again that he's only concerned with spread, stopping the spread. He doesn't care about other public health issues. He's not looking at anything like cancer treatments that have been foregone, surgeries that have been foregone. He's not looking at any other potential other health crisis. And I think that's the problem with Dr. Fauci. And then, we could elaborate and go on, but I think Navarro hit a real sharp nerve there with that. I thought it was a good piece. And you're right, he's not the only one that's expressed those concerns. I can tell you that.
And you bring up an interesting point, too, where epidemiologists, for example, look at it, as you're just saying, almost in a vacuum. That is their job, to look at the stop of the spread. But then it's the job of executives, politicians, policymakers, to decide how that weighs against other risks, whether it be the economy, whether it be sending children back to school or not. There are other things that we talk about on this show, for example, whether it's the increase in opioid overdoses right now, depression, domestic abuse. There are side effects to these lockdown orders, but that's not to say that lockdowns are completely useless altogether. In fact, in your home state recently, you've seen a little bit more of a surge when it comes to cases recently. There were some restrictions imposed, but it is that wait and see type of approach that is, a lot of people are saying, should be the way that we see this. Do you think that's the way that we should be handling this crisis?
Well, the data's in. It's real clear about children in schools. I think the first thing you do is you have to say, let's get back to school for the kids. That's the first thing, because the data is clear. And in spite of Dr. Fauci, I think it's widespread in academic circles and science and medical circles that kids could go back to school. The other issues that you have, and this is where I like Georgia's governor's approach, for instance, on masks. He says that is a personal and private decision. So if you own a private business, guess what? You get to determine whether people are required to wear a mask coming in, how you're going to enforce those rules. I'm still baffled by this notion that we're going to say to some establishments, you know what, you can't make the decision, but other establishments, we're going to say you can make that decision. That to me is an uneven way to administer some of these policies.
And building on that, too, I think that creates the mistrust that we're seeing a little bit when it comes to public health officials, where some protests are permitted. Some of them could be a public health risk. Sometimes you could go to this business, you can't go to this business. Same thing with churches and now schools. This lack of uniformity is something that is creating mistrust in the public. And you can get mad at people for not wearing masks, but at the very beginning, the government telling people not to wear masks is the reason why we're even having this conversation to start with. There has been a lack of conformity, a lack of a unanimous message coming out when it comes to these important decisions, and that is creating the lack of trust among the people when it comes to responding to this crisis. I think that's an excellent point. But Representative Briggs, I appreciate you coming on tonight, breaking down this issue of coronavirus and where we go next. Thank you very much, Congressman.
Thank you.